Hello, my name is Jacqueline Groen, and I will be discussing empathy characteristic of physical medicine providers who treat osteoarthritis. So first, I want to talk about the significance, and I broke it down into three categories: empathy gap, empathy trait, and mental health. Empathy gap, in the simplest terms, is a misunderstanding of emotions, specifically in context with osteoarthritis and how it affects those patients specifically, and found that through medical training, there is a decline in empathy. So with this research, we were determining what two components were important with understanding the empathy gap, and we landed on empathy trait and mental health. With empathy trait, we're hoping that with more education for the medical providers and cognitive and emotional understandings in those dimensions, it will improve overall patient satisfaction. Interestingly enough, increased anxiety and depression have been found in interaction with disability, specifically with those who have osteoarthritis. To continue, our target audience is osteoarthritis. With the mobility limitations and the different dimensions of pain that they have to go through, it's not only emotional but mental and physical that osteoarthritis patients have to deal with. The specific type of providers that we targeted were physicians, so medical doctors, and therapists, specifically physical therapists. So we were seeing if, with the brief encounters with a medical doctor and their aim with medications and surgery, how that would affect the patient. And with physical therapists, they have the prolonged period with a patient, and they mainly focus on mobility of exercise. And to the right, you can see an example of a range of motion movement with a patient. So the purpose of this research was to investigate empathy trait and mental health beliefs of physical medicine providers in osteoarthritis care setting. Some of the questions that came from this were: does provider type MD and PT differ in empathy trait? And do providers show patient mental health knowledge? So with our methods, we had recruitment process of online surveys, word of mouth, and social media. And to the right, you can see the actual survey used, which was posted on LinkedIn to get those participants. We had a total number of 44 participants, ranging from physicians and physical therapists that were in training or in practice. The assessments used to measure empathy trait, specifically known as the Jefferson scale of empathy and the Interpersonal Reactivity Index. We had a total number of 27 complete empathy trait. And with the mental health, we had the Generalized Anxiety Disorder 7-item scale and the Center of Epidemiologic Study Depression scale, which we had a total number of 22 complete. So a total number of 22 people completed both empathy trait and mental health assessments. So some of the statistical analysis that we found was: do provider types differ in empathy trait or mental health expectations? We determined this from independent sample t-tests. This was between the medical doctors versus physical therapists on each item. So from the JSE, the IRI, the GAD-7, and the CES-D. Next, we were determining, are the JSE and the IRI similar in assessing empathy trait, with a Pearson correlation, which determines the relationship between them. Next, we did the similar Pearson correlation between anxiety and depression expectations, which was our mental health assessment, which is the GAD-7 and the CES-D. So here were our results. The first table bar graph is showing the empathy trait, and the second is showing the results of the anxiety and depressive mood. On top of the blue and orange bar graphs of each shows the p-values that were conducted through the independent t-tests. Also, the blue bar is the medical doctor responses, and the orange bar is the physical therapist responses. Below each table shows the correlation statistic, Pearson, showing the R value and the p-value for both, and next to it are explaining the moderate or strong relationship. Some of the questions that we answered during our discussion: do provider types differ in empathy trait or mental health expectations? Based on our data, there wasn't that significant of a difference. With the JSE and the IRI, we were also determining if they were very similar. They are related, but only moderately. So there are more complex and multi-dimensions with each. So either or could be used, but there are different dimensions to which one you are using. For the anxiety and depression assessments, there was a very strong relationship. So that means that the mental health understanding is very poor, because they are trying to state that if someone has anxiety, they also have depression, which is not always the case. Limitations and future investigations. The limitations we had with this experiment It was a very heavy survey-based experiment, meaning there was that self-report error. The collapse training and practicing, meaning we had different types of physicians and physical therapists who were training to become certified and those who have been practicing for a few years or maybe just a year, in that there could have been discrepancies in their responses. Lastly, this was conducted during COVID-19. We have all been through the issues that have come across with that. Future investigations could focus mainly on the mental health aspects and take a more deep dive into understanding why there was that strong correlation between. Another way an investigation could go is get patient input on how they feel their providers are helping them with their emotional and mental status. Another easy way for another investigation would be simplify the methods to only use the JSE or the IRI. These are the references.